Hello everybody, this is Dr.Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very common problem which is abdominal obesity. If you look around you, you will notice that people have a pot belly and the pot belly comes first and the person follows. In the olden days, people were not bothered about their pot bellies. The men thought it was an indication of prosperity and wealth, and the women were very happy that their husbands had a huge pot belly. Also, people wore dhotis and lungis and not pants. So the bigger the abdomen got, they just tied the dhoti a little looser. There was no question of the pant not fitting. Now times have changed and people have become conscious of their looks. Women who used to think that they could hide their tummies in a loosely tied sari and in an A-line salwar now also want to look good and look like the actresses and the models that they see on stage. Actually, abdominal fat is of two types. First is the subcutaneous fat, which is just under the skin. It is soft and can be easily pinched up. The second is the visceral fat, which gets deposited inside the stomach and then pushes the stomach out. This visceral fat gets deposited around the various organs and itself acts as an endocrine organ and secretes poisons called cytokines. People who have a lot of visceral fat, they are more prone to develop colorectal cancer, they develop diabetes, hypertension, and they are more likely to get stroke because their blood is very viscous. From the visceral fat, the portal vein carries this fat to the liver so they can get liver disease also. People who have visceral fat are shaped like apples and people who have subcutaneous fat are shaped like pears. The type of fat that you have and where it is deposited depends on your genetics and also the lifestyle that you lead and the food that you consume. Many people think, oh, I've got abdominal fat, I'll do some sit-ups, 100 sit-ups and 100 push-ups and crunches and get rid of it. That really doesn't work. It is not possible to spot reduce abdominal fat. You have to reduce the overall fat and have a healthy body. To do that, you need to reduce your caloric intake to 1,500 to 2,000 calories a day. Do weights and exercise aerobically for 150 minutes a week. This doesn't seem like much, but the important thing is to be consistent about it. Some others feel that, oh, if I have abdominal fat, I'll just go for some bariatric surgery or I'll get my stomach banded or I'll do liposuction. These are all immediate cures and short-term cures. The abdominal fat will slowly return unless you maintain the diet and the exercise. Children sometimes appear to have a pot belly and the parents get very worried. But what you have to do is to make the child stand and lift both the arms up above the head. If the pot belly disappears when you do that, then it is not a real pot belly and it will disappear as the child grows older. You have to worry about a child's pot belly if there is fever, if there is pain, if the child is of short stature, or if the pot belly appears suddenly and was not there earlier. Then you need to take the child to a doctor and check what is happening. How do you know that you have? Some people in India are thin and they still have a pot belly. How do you know whether you have a belly which is larger than normal? It is not just the look. You have to take a tape measure and measure it. Your waist should not be more than 40 inches in men and 35 inches in women. But when you're measuring your waist, don't breathe in and hold your breath and then measure at the thinnest spot that you see. You have to measure at the umbilicus. The other way to measure this, especially in a thin person who has a pot belly but whose waist is only 31 or 32, is to do the waist-hip ratio, which should not be anywhere near 1. It should be less than 0.96 in men and 0.86 in women. Sometimes people think that they can take tablets and reduce weight, but all these tablets, even the newer ones, have side effects. So the best way is to do it naturally, exercising, maintaining a diet and doing weights, but regularly and consistently. Stay healthy, stay happy, maintain your weight, lose your pot belly. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.